Hello there, I'm Tanya and this is the lovely Cookie, and Cookie has come in for a vaccination today, so I thought I would use the opportunity to show you what will happen during the clinical exam of rabbits when they're with us having their vaccinations during COVID. We are very sad that you won't be allowed to come into the clinic during this time, so we thought we'd at least try and bring some of the consultation to you in this way. So we'll do a nose to tail exam from nose right the way backwards. So we assess the face and we have a good look. Come on Cookie, come up, let's have a look. And we look for symmetry and we look for a nice clean nose, and we look at the eyes and the ears, and we just have a general overview and a general look. And then I also like to listen to the chest. So I'm just having a little listen to his heart, and it's beating very fast. I'm just going to look at the clock. So his heart rate is about 200, and his breathing rate is about 80 as well, and that's pretty normal for a rabbit. He's panting a little bit, and his heart's going at a normal rate. I can also actually listen to his abdomen, so I can listen to his guts, because we want to hear nice, lovely gut sounds, because rabbit guts should be making noises all the way through the day. Good lad. And then what I want to show you now is a really top tip for being able to have a closer look at things like toenails and things where they might wriggle, and also just having a look underneath. So we can have a look at bottoms. We hold very loosely on the top end, but we can have quite a secure grip on his bottom end, and we can just have a look at his bottom to make sure it's clean. It's clean and dry. And as you can see, Cookie is a boy who will at some point need to be neutered so that he settles with his behaviour. So one of the best tips I can give you is to have a towel as well. So we'll always have a towel when we examine rabbits. And what we tend to do is do what we call a bunny burrito. So we wrap them in a towel just like so. And it gives us a better way of being able to examine them without them necessarily scrabbling or being fractious. They tend to calm down a little bit when wrapped. Okay. So we're going to have a look at Cookie's teeth. And we're going to have a look at his ears. So if I turn him this way, we'll have a quick look at his teeth. So we use this device to have a little look. So we just lift the chin, good lad, and we just look, gently look, gently, good lad, good lad, good lad. Ah, good lad. Says I'm chewing it this time. Good lad. He says I don't like you looking at that side. Good lad. So we get an idea of what the molar teeth look like. We can also have a look in his ears, and we can certainly use the same instrument. Let's change the head. Can we change the head and have a look at your ears? So we can have a little look in the ears. And they're lovely and clean. So we've had a look at mouth and ears. We can also, apologies, I'm not sick, I'm just slightly allergic to rabbits, would you believe? If we want to look closer at bottoms, sometimes it helps to just put the lights out. So if we just cover their heads gently so that it goes dark, then we can get a good look at bottom end. And we can just have a little look under the tail, just to double check that everything is clean and dry under there, okay? And we will take their temperatures before they have vaccines. Cookie has already been subjected to that today. We like to make sure that they're fit and well for their vaccine. Okay, so the final check is a little feel of the belly, and then we're good to go. And Cookie is in great shape. He's a really good fit and well bunny that just deserves to be loved and have a loving home, which is very lucky for him. He's going to his new home this afternoon. I'm now going to give him his vaccination. So this is the vaccination. This is his MIXI RHD vaccine. So it's a combined myxomatosis and our rabbit hemorrhagic diarrhea vaccine, and he will need an additional vaccine in a few weeks' time against RHD2, which is a new strain of virus. So I've drawn this up already, so this is ready for the needle, and then we just literally inject it under the skin, and as you can see, Cookie is not phased at all by it. Just get rid of the sharp, and that's it. That's welcome to your rabbit vaccination consultation.